Hey, we're going to get started here. I am Dan Cheadle, and I am Vice President of Marketing with LCB Rewards, where we are a printing company and a whole lot more. If you have been to our site, you've had an opportunity to check out some of the different things that we do. Great. If you haven't, you are more than welcome to go to lcbrewards.com. There you can find amazing printing deals, all kinds of stuff. And obviously you'll find more information on Impact Health. This presentation is all about um, Impact Health. And it's an amazing opportunity. If you are a small business person, if you're a small business owner, if you have a brick and mortar, you have employees, you're going to want to pay close attention because this is in my opinion, this company is going to change the way that health insurance and healthcare works and how people respond to it. So I'm going to get right started. I'm going to open up, I'm going to do a share screen. Bear with me here just for a second. Let's do the share screen. There we go. Okay, we're going to do a share screen. I'm going to jump on our PowerPoint presentation. I'm going to use that slideshow from the beginning. And welcome. And I am going to be the presenter. And we'll just run through this. We'll see how we do. So name of the company is Impact Health Sharing. This is the opportunity that we're going to be talking about. These are the different things that we'll talk about is who is Impact. So we're going to talk a little bit about the company, why Impact Health, how does it work, who can join, personal consultation directly with the company. This is an amazing part. Even if you're looking at this as an opportunity and you want to join our marketing, become part of our marketing system, this is going to be a really, really big, important tool to utilize. Customer only, our opportunity to share for more income, getting started. And then at the end of this, I'll have a few minutes where we can do a Q&A where we might be able to get some questions answered as well. So moving through it, who is Impact Health? Impact Health was started by Phil and Angela Chrysler. If you know the name Chrysler, somehow, some way, the name Chrysler rings a bell with you. That's probably because of the auto industry. And Phil is, I believe, one of the grandsons of the founder of Chrysler, the Chrysler family. Phil was raised in the auto industry, so he is very familiar with all of the different aspects of insuring employees. Phil, through all of his experiences, learned that insurance companies do really make a lot of money. In fact, in some cases, they can be kind of a downright scam. Since COVID, a lot of your insurance companies have raised their deductibles, raised their premiums to the point where people can't reach or meet their deductible. And when they can't meet their deductible, then what happens to all that premium payment that they make every single month? It's pure profit to the insurance company. I happen to know several people that have been in that situation, and it's pretty rotten. So Phil decided in 2019 to launch a much better plan, a health plan that really makes sense. And it's all about common sense. It's all about common sense and doing things that make sense. So, and that's what we're going to talk about. Why Impact Health? According to the US Commerce and CBS Research 2022, 50% of Americans had no insurance or very poor, inadequate coverage. That is a huge number. We're talking over 150 million people in this country that are not in a very good health coverage, health insurance plan of any kind. About 50% of that number, or approximately 75 million Americans, cannot afford health insurance. They're not working, they're unemployed. But the other 75 million of that number are working, but they have very poor coverage. And guess what? They don't know about us, but we truly can be a solution. So since COVID, insurance premiums have risen by about 35% nationwide. 2.7 million Americans since COVID have actually lost their health insurance. Guys, this is a really a big deal. So there's a lot of things that we're going to be talking about on this, but I'm going to go fast. If there's anything that you don't understand, we'll be able to talk about it at the end. So how does it work? I'm just going to hit some very good bullet points here. I'm not going to touch on everything because there's a lot more to this that are just huge bonuses. But I want to just really, the whole point of this presentation is, number one, is to get your attention and make you aware, and then go to the next step of you saying, hey, I really want to learn more about this. So let's talk a little bit about how it works. Impact Health will lower your monthly premium. They usually, on average, by 30 to 50% in many cases. You can choose your deductibles so that your deductible can tell you kind of where your monthly payment's going to be. So you have some flexibility in deciding that, versus a healthcare plan saying, here's your deductible, here's your payment, take it or leave it. Very important. That's huge. That's a big deal. Your deductible covers the whole family. I have a couple of different cases right now. Just recently, the deductible went from 13,000 down to 2,500, and the 2,500 covered the whole family. We're talking 4 people: husband, wife, 2 kids. And this is what's really cool, is that almost everything that you do health wise, like if you go to a chiropractor, the visit counts towards your deductible. If you have a dental visit and you're doing a cleaning, that can count towards your deductible. So all of these different things that many insurance companies have dropped from going towards or getting credit towards the deductible. Pretty much almost everything that you can think of that's health related can count towards your deductible. There's no network. You can choose any doctor, anytime, any place, anywhere. That is, again, it's a big deal, because if I'm in a network and I don't like the doctor I've got, I'm stuck. And if I'm in a Blue Cross Blue Shield where I might be an 80/20 with a high deductible, man, I'm really stuck. So this is very common. And so this is why I think our opportunity, this is going to be a game changer for so many people, is now you can go to any doctor that you want of your choosing, and they will honor the Impact Health. And so that's a really big deal. Your out of pocket is 90/10. Any age can join. There's no restrictions. Providers are paid within 17 days. The reason we have that in caps, pay very close attention. This is a big deal. When you go to a provider and they look at your card and they may not have heard it, they can call our hotline to Impact Health and talk directly to Impact Health and say, hey, I've never seen this before. I'm not familiar with it. How does this work? And they're going to say, doctor, glad that you called. We'll give you the fine points, but if you're not in the system, we can very easily work with you and get you into the system. More than likely they are in the system, they just don't know it, because there's a lot of big network systems out there. But the doctor just may not be aware that he's in the system, but they will walk him through all of the different things. Very cool. So you don't have to do any of the work, or any of the legwork. The doctor will. And then they'll tell them that, by the way, once you're done with our client, our mutual client, we'll just make sure that your billing clerk gets the invoice to us, and we pay that within about 17 days. The doctor's going to be like, oh my God, you guys are great. So that is a big deal. Providers love Impact Health. So here's just a quick snapshot. Down below, you'll see the sample card. You'll see the different payouts. Office visit, what you pay. Urgent care, what you pay out of your pocket up front. Specialist. So it's all right on your card. There's nothing left for your imagination. And the reason that I have this slide in here is I want you to take a look at the top part. Impact Health negotiates your final bill down. This is something that they do on a regular basis. Let's say that you have a one-night stay in a hospital, like I did. I had a kidney stone, and my kidney stone bill was $22,000 for my overnight stay with my kidney stone. It was amazingly horrible experience, but and I have a very, very good plan through my wife who's a retired Michigan teacher. So we have a very good plan. But my deductible wasn't completely met. I had a $400 deductible, so I had to pay part of that. And then after everything all said, our out-of-pocket bill was around, I think it was right around $2,300. Um, Impact Health would have negotiated that bill down. And so here's an example: one night stay, 13,000. Negotiates an early payment discount of $2,500, and now the balance is down to 10,500, and your 90/10 payment is reduced down to 1,050. Impact Health just saved you $300 out of your pocket. Amazing. And so this is what they do. This is common. Why do they do this? It's because they're a nonprofit and they're not in the business of holding on to money. They want to pay these doctors right away. They want to pay these medical centers right away. So there's an incentive to give us a little bit of a discount on the bill because we're going to pay them right away. They love to do that. I mean, they're in business because they have so many people that don't pay them that they have to chase. This is refreshing to the doctors. It's refreshing to the hospitals. So who can join? Anyone, any age. You can have pre-existing conditions. They're okay. Diabetes. We've got a lot of different people that have pre-existing conditions. Cancer. You have to be 36 months free of cancer. Then you can join. So even people that have cancer that have been cancer free. Some conditions might be limited. Impact Health offers a free consultation prior to joining. So we always encourage people, hey, before you do anything, before you decide to do anything, talk to Impact Health directly. Get a consultation, talk to them, get all your questions answered, and then we can move on. You can make a decision, an intelligent decision. Large families can join. This is what's really cool. We were talking about the deductible before. Let me go back and just restate. Coverage is based on the oldest member and then the next two family members. That means that if you have a family of four, mom and dad's the oldest, the insurance is going to be based on dad. And then that's the monthly premium. And then you get to choose your deductible. In most cases, people will choose a $2,500 deductible. And then from there, if you have two kids, they're all covered. If you have four kids, they're covered. If you have six, you have 10 kids. It's all your payment doesn't change, and your premium, your deductible does not change. Your deductible is based on the whole card. So how cool is that? You can have 10 kids, and you still have the same low payment and the same low deductible. I got to believe that a family of 10 could use that $2,500 deductible up in a couple of months. Small business owners, this is a biggie. If you're a small business owner and you have employees, whether you have one or two or three employees, you can join. In most scenarios, Blue Cross, Blue Shield, there's lots of plans out there that a small business can't join until they have 10 employees or more. In this situation, you can have one or two or three or more employees. So that's a biggie. Business owners can offer to pay anywhere from 10 to 100% of monthly premiums. So it is up to you as the business owner how much you want to contribute to helping your employee with their coverage. They're going to have a great health coverage plan here, and then you can contribute whatever it is that you want from there. There is and again, we will go back to this, a personal consultation with the company. It is set up through a calendar link. You set up on a time and appointment with them. And then you're not on the clock. You get the meeting link, and you can talk to a representative from the company, and you get all your questions answered. And they say you can talk as much as you want. Let's get all the questions answered. So here's one of my favorite things to start wrapping this up with is, who do you know? Every family member works hard, and yet we suffer from poor coverage and high deductibles. Who do you know that could be a great candidate for helping? What is the next step for helping them? The next step obviously is going to be, let's get them in touch with one of our consultations and get all the questions answered and see if we can get them into the plan. So whether you want to be a customer or an opportunity or both, if you want to be a rep. As a customer, it's a simple phone consultation, and then you can make a decision. This is important. You are not required to be a rep or a distributor or a member. You can simply be a customer. If you're interested in joining our opportunity and becoming one of our reps, there's no license required. There's no insurance license. You don't have to get a license because you are actually joining our network of distributors that is distributing this thing. Small startup fee, a monthly web system, a maintenance fee is required. I think the startup fee is like $2.99. It's a one-time payment. And then you pay about 25 bucks a month for the maintenance on the system, and you are free to go. Commissions and compensation plan is provided through a marketing partnership with ACN. The opportunity to help 45 million Americans, or it's a 15 to $30 billion opportunity. That's what we are looking at right here. So that's why I think this is going to be a game changer in the health industry. You can sell, enroll, and service customers, or you can build a team and have long-term growing residuals from team efforts. So you can duplicate your efforts. You can build a team and um, an IBO concept, which is, IBO is independent business owner. So you're in business for yourself, but not by yourself. That is our company slogan. So we want to talk a little bit about the opportunity. I'm going to kind of just give you just a real quick gloss over of the opportunity. Impact Health partnered with ACN to market the business to individuals and small business owners. So now they have a complete marketing system. Not only are they Impact Health as a standalone nonprofit company that's helping people, but as your primary income, you can market the program or market all of ACN products and services. So once you become an ACN partner, marketing partner, there's a lot of products and services that are included that you can market. Everything from phone, mobile, gas, and electric, where you can lock in rates, internet services, dish network, home security services, identity theft products, and a whole lot more. I'm going to go through the compensation. People are going, well, then how do I make money at this? Well, how do I make money, and how does it work? So let's just do a real quick. This is just, again, it's an overview. If you want more information on how everything works, there's a whole lot more information to this. This is just to kind of wet your whistle a little bit and give you some attention. Each ACN rep must become what we call commission qualified. This is accomplished by accumulating 7 points from personal sales and acquiring a few customers. At this level, you earn 3% monthly commissions on all products and services monthly bills. Now, let's stop there just for a quick second. I'm focusing on Impact Health. That's it. I really want to focus on that. Now, there are other products and services where I get my 7 points and I accumulate that, and we'll talk about that in a second. But think about this way. What is the monthly payment that people are paying for Impact Health? 300, 500, 200, 700, 800. Whatever their monthly payment is, that's what we're making money on. This thing, folks, this is going to just get huge as time goes on. You build up a nice, very, very nice nest egg of a team that's building this out, and you're getting 3% every month on all of those different monthly bills, and that includes your team. So as your team grows and they acquire 7 points or more, your total points are cumulative from your total team activity. It does not take long, and you and your team acquire 30 points monthly. Now, you become an ETL or an executive team leader when you hit 30 points. It doesn't take long to do that. Your commission goes up to 5%, just like that. So imagine if you had 5, 6 people, right, and they all had 7 points, kabam, just like that. You've hit your 30 points. So I can't emphasize enough, it doesn't take long to do that. As you progress by growing your team, training your team, and accumulating more team points, the points go from 200 to 3,000. Your commission goes up to 20% monthly on all product, services, and bills. Now, there's a whole lot more to this. There's bonuses, and there's monthly incentive boards and everything else. I could get into the whole compensation plan. I don't want to do that here. This is just to give you a really big picture of the potential. And from there, we can really get into the nuts and bolts of how everything works. There are many perks included, like ACN Rewards Plan for loaded exclusive coupon offers like BOGOs at thousands of local merchants. This alone is well worth the cost of membership with all the savings. So my wife and I just recently, this past weekend, went for a little color tour in northern Michigan. We actually took advantage of one of those perks. We ate at a super nice restaurant. We both had fall off the bone ribs at an amazing restaurant. Her dinner was free. We had a buy one get one free through this perk program. So it does work. Everything works, and it's pretty cool. There's a lot of behind the scenes bonuses, and so. How do you get started? So joining as an IBO, you're going to become an independent business owner. You're an independent rep. ACN was founded in 1993 as American Communications Company, and so that's how they came up with ACN. They started with gas and electric and some phone services as products. Today, they have dozens of tech products and services, so it is not difficult just on your own to get your 7 points and become commission qualified, but you've got family members, you got friends, you got associates. It's probably the simplest thing that you can do in terms of getting started is getting those 7 points. And then you start building your team and you'll help. And we work with you. We'll show you how we do it. We have a whole marketing system on how to build your team and get that. That's for another day. When joining, each IBO gets their own back office and website to market to the public and future customers. There are plenty of marketing training videos included in the back office. Each week, there are plenty of live webinars. I just did one yesterday. Training webinars and live product presentations, including Impact Health. I have a recording from yesterday that they did on Impact Health and had a live, it was a live meeting that they recorded. So I'm going to get that link and I'll be able to have that available to everybody. But we had, I believe, I'm not sure if he was a cardiologist on there or a lung specialist, pulmonary, but he had not bad insurance, but he actually joined Impact Health because they were able to lower their monthly premium from $1,800 a month down to $800 a month. And with their deductible, he was able to lower his deductible. And he actually started sharing this with other patients that he knew that needed better coverage. And he was actually blown away by the fact that it actually works. He had a doctor's visit on himself. He was impressed by the fact that he was able to choose his own doctor that he could go to. So it's a great testimonial. And that was in our meeting yesterday. So we'll be sharing that with people. To sell Impact Health or any ACN products and services, each joining IBO pays a one-time $299, $300 enrollment fee. Thereafter, IBOs pay $25 per month for back office support, marketing, website maintenance. All of the above are 100% tax write-offs. So this is a business. It's a real business. Just like any business, there's a little bit of a cost to get started, but it's all tax deductible right now on your tax return. So let me wrap up. Healthcare is the single biggest concern and expense in America to any small or large company. 50% of America is a prospect for our product. There you go. So guys, it is not difficult to find people that have bad insurance and are looking to make a change. That is like the easiest thing in the world. Hot buttons are small businesses, small young families with high deductibles, single employed with high deductibles and premiums, small health centers, hospitals, healthcare providers. There is something I'll touch on just real briefly. If you are by or close to a small health center or a small hospital or healthcare, it wouldn't hurt to talk to them and to say, hey, would you guys be interested in learning about this program, learning how you guys can get paid in 17 days or less, and if we could have a conversation. And they're going to say, sure, come on, bring in what you've got. Let's sit down. We'll take a look at it. And you don't need a brochure. You don't need anything. You just need to get them on the website. And you share your own back office website with them. And they're going to be able to see in black and white who we are, what we do, and what we have to offer. And the next thing is going to be is, how can we promote this to your customers to maybe help them get better coverage which means that you're going to get paid quicker. Does this make sense? And so it's really, truly just an exploratory meeting to see, hey, does this make sense? And I already have several meetings in the works. I'll stay tuned and I'll keep you posted on that. All healthcare providers like chiropractic, eye care, ophthalmology, physical therapy, dental, hip and shoulder specialists are great targets. Those are all great people to talk to about helping to partner with us and to promote this plan. Because we pay in 12 days or less, or 17 days or less, they like us and are even willing to negotiate on your bill balance. And we've got lots of examples of that. Impact Health has specialists and consultants on standby to take your call, appointment, or getting your questions answered. As an IBO, you don't have to do the selling. Simply connect your client to the company and let them do the work for you. It's what they are there for. IBO is in business for yourself and not by yourself. So we are now ready. We can do a 10-minute Q&A. We want you to, before I get started with this, and then I'll open it up for some questions, get with the person that helped you find us or sent you here. All right, we appreciate you guys being here, and then we will open it up for questions.